Well, this month is Mental Health Awareness Month, and mental health care is in high demand across our country and in our community. ABC7's Rosemary Montañez spoke to those at Texas Tech Health El Paso about how the next generation of psychiatrists are taught. This story is part of our Be Mindful initiative.
With a growing need for mental health services also comes a need for mental health specialists. One assistant professor at Texas Tech Health El Paso told me medical residents are trained to handle real-world scenarios involving the mind.
And we're just recognizing how important it is to treat our mental disorders just as much as physical disorders.
Dr. Patricia Ortiz says she always wanted to be a psychiatrist after seeing how mental health conditions impacted those she loved.
This is a really important field that needs to be addressed, and so more people are rising to the challenge.
Andrew Serafin is one of those who stepped up. He's a fourth-year medical student. Before that, he worked as a licensed therapist for 15 years, working with patients dealing with mental health illnesses. He says back then, patients would wait weeks to get help because of the lack of services. He says much hasn't changed.
I do still hear that quite a bit, that there needs to be more emphasis in mental health, that it's something that needs to be assessed.
Both say the stigma is still prevalent. Would you say there are enough conversations happening surrounding mental health?
Certainly some stigma attached to it for people, and sometimes people just simply don't want to talk about it. It can be uncomfortable.
Dr. Ortiz says medical residents are going into clinics and training in hospital settings, learning how to interview patients, diagnose disorders, and treat the most common ones.
It's hard to prepare them fully. You never know what's going to, what patient is going to present for you.
They undergo simulations with actors who pretend to have mental health disorders.
Yeah, I think throughout their education, cultural competence and empathy, good listening skills are always emphasized and are very important in their education.
But Dr. Ortiz says in the classroom, students also learn about the importance of their own mental health.
Making sure that they are taking care of themselves in terms of wellness, and I think that helps them also to impart some sort of help to patients as well, in terms of making sure that they're getting enough rest and exercising regularly, eating healthy. These types of basic things are integral to our general health and of course our mental well-being.
How did you take care of your own mental health when you were seeing these situations up close?
In med school, I guess I spend time with family, doing things with them, trying to make sure I always carved out time for downtime, really. So with family, with walks with the dog, making sure I had enough sleep.
And Dr. Ortiz hopes one day everyone will be able to talk about their mental health openly.
Not being worried to say, oh, I'm going to go see my therapist next week, just the way we say I have a doctor appointment or my annual checkup. One day I hope we can get to that point where we have enough providers to do that for everyone, and where everyone can feel comfortable talking about their physical and mental health.
And Dr. Ortiz also told me the COVID-19 pandemic actually exposed a lack of mental health services as more people started seeking mental health support. Her hope in the future is that more students will go the mental health route in their careers. Reporting, Rosemary Montañez, ABC7.
And this story was part of our Be Mindful initiative. ABC7 is doing mental health stories daily all month long. To watch other stories like this one or find resources, go to kvi.com and click on the Be Mindful tab.